Yes, today we are discuss the this topic also, middle cerebral artery. Today also we are discuss the few things about this middle cerebral artery. Middle cerebral artery anatomy and blood circulation of the lateral part of the hemisphere, the both two hemisphere, there are two circulation supply to the laterally. The mainly we are discuss about the dominant side. The dominant lot of people is having left side hemisphere is the dominant hemisphere. The middle cerebral artery circulation occlusion and the circulation drop of the these internal area and lateral cortex area. What are the main sign and symptom we can understand? We discussed before these things. Now today the main important point we are going to discuss why we are talking the middle cerebral artery. It is the most deepest inside the brain. The main organs give the circulation supply of this arterial supply. This artery occlude proximally and lateral, insular, superior and inferior circulation is the lateral distal part also that can be occlude. The proximally occlude this circulation embolizing some form of malformation, some form of circulation drop to the distal part. Some form of road traffic accident also can be occur in this hemisphere. Right. Today we are discuss the main special 2 point. One of it is the some form of visible sign, visible symptom. We can see the hemibalasmus. 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 The hemibalasmus. Hemi is the some form of affected side. Contralaterally affect this problem. Second one is the hemianopia. Hemibalasmus and hemianopia. That is the most important 2 point when we see the CVA, cerebrovascular accident inside the brain. Dominant part is the middle cerebral artery damage. We can see that patient having some form of hemibalasmus, the unnecessary movement, and hemianopia, the visual field, lateral side, some form of lateral side visual field block. That is 2 point we are going to discuss. First of all, we take this hemibalasmus. The hemibalasmus is the involuntary, unnecessary, unthinking pattern of movement. Involuntary, that's the hemibalasmus is the involuntary movement, unnecessary movement, and unthinking notice the conscious mobile of the movement. That's the main important point. We will discuss the hemibalasmus. The hemibalasmus is the we are drawing that point. What is the area in the unnecessary involuntary movement occurring area? This is the affected head and contralaterally leg, trunk, and upper limb, and contralaterally face. Hemibalance must affect the face, contralateral, hand, proximal girdle, trunk, thorax, lower limb. These hemicide movement involuntarily move suddenly. That's the most important point. Suddenly move. The hands also they go suddenly upward. Trunk also they go suddenly sideward. Leg also they go suddenly upward. And unnecessary flexion, extension, rotation, and the several flank movement motivate in this area. But he can do the voluntary activity. This affected site, he can do the some form of purposeful activity. Take some glass, eat it, feed it, some form of writing, or lot of purposeful activity he can do. Why he can do this purposeful activity? The main supply of the brain is the main direct connection of the brain is the clearly connected. But the other indirect connection, the cortex, thalamus, quadrator nuclei, lentiform nuclei, and basal ganglia, it's the other connection is damaged. The direct connection is good, the other extra connection is damaged. Due to that damage, this hemibalasmus unnecessary, involuntary, unclear movements suddenly occur the affected side. That's the most important point. Now we are going to discuss inside the brain affected area. I am drawing the clearly. This is the brain. This is the brain posterior part. This is the brain special organs. How did this special organ affect the hemibalasmus and occlusion of the medial arterial supply. What is the main thing? What is the main area damage due to this problem? This is the thalamide. This is the subthalamide. This is the substantia nigra. This is the lentiform nuclei. This is the chordator nuclei. The sensory pathway go through the ascending tract, descending tract, spinal area, ascending, descending tract, spinal area. This is the spinal cord, medulla, pons, midbrain. This is thalamide. Give the thalamide sensory input. It is the ventral, posterior and anterior divide some form of area. Then give the direct supply of the cortex. The cortex also the give cortex radiator. Cortex radiator give the direct supply. That is the sensory input and suddenly out of the motor input in this area. This is the middle central gyri. This is the central gyri. Anteriorly supplementary premotor area and motor area. Posteriorly sensory, presensory, supplementary sensory area. The motor area most important to feedback again and again and undirect supply of the motor function. Then the motor area give the feedback supply to the quadrator nuclei and lentiform nuclei. Lentiform nuclei divide three parts: putamen, globus pallidum anterior and globus pallidum posterior. Globus pallidum internal and globus pallidum medial. Then the lentiform nuclei and quadrator nuclei mainly important to modify the motor function. The previous motor function, connect the previous motor function and modify the motor function and again refresh the motor function. This area, the premotor area, motor area and supplementary motor area give the modify again the all motor activity clearly and purposefully. Then the give the again supply to the quadrator nuclei and lentiform nuclei and subthalamide and again thalamide again go to the cortex of the motor. That is the most important system inside of the brain. When the thinking ability, the memorize ability and targeting ability and timing ability and sequence ability, all ability clear and frequently and gave the super function of the brain. This is the most important function inside the brain. In this function, when we are talking this function, some form of this function inside the brain cut off some area, the quadrator line or lentiform line or subthalami line or thalami line, or again give the motor area, this line, or some form of substantia nigra dopamine secretion, or so the connect these function. Some form of dopamine correctly and clearly not give this function also the damage again. Then we are going to talk about the some form of damage inside this area. The most important the axonal secretion thing in this area. What are the main axonal link in the other axon and connect the nuclei, the connection in between two, what are the main neuronal secretion inside this area. Going to talk about one by one. The cortex and quadrator nuclei and lentiform nuclei give this some form of acetylcholine.